Okay. Good evening, everybody. Thank you so much. I can speak for my entire team. Thank you to the commission members for this opportunity to address you all tonight. My name is Morgan Poindexter, and I, Caitlin French, Julea Shaw, Rowan Boswell, and Aarthi Sekar will be presenting to you tonight. As Bapu said, we're a group of Davis residents and researchers with the group Yellow People Power, here to share our findings with you on the social determinants of public safety, which hopefully will help you inform both this commission and the Davis City Council as you seek to re-envision public safety and policing. So first, we will identify the current landscape of public safety in Davis, which is, like most, if not all cities in America, primarily focused around law enforcement. We'll then explain an alternate approach to public safety, which mirrors existing public health models. And then using this conceptual framework, we'll analyze more closely our city and the underlying root causes of the most prevalent public safety challenges. Lastly, we will present existing alternative practices that have been effective in other communities at modeling a social determinants approach to public safety. So to begin, we investigated the available Davis Police Department data at various points of contact with police to determine the current landscape of public safety in our city. So the first point of contact with police for which data exists is in the form of calls for service. So when citizens dial 911 or other non-emergency police numbers and request assistance. We received the call logs for the last 5 years and sorted them into categories which are arranged from left to right, least to most severe. So we found that the vast majority of all service calls are for non-violent incidents, with calls about violent crime only accounting for 1.4% of the total. This suggests a large area of opportunity where unarmed first responders may be substituted for traditional armed police officers. Of note, of total service calls, checkups like wellness checks and mental health checks were nearly 22% of these service calls. So over 1,000 mental health evaluation requests were made over this 5-year period, suggesting a prime example of an area where trained mental health professionals or unarmed crisis teams and first responders could be utilized. To note, calls specifically pertaining to alcohol and drugs were rare, though there are other overlaps with categories here, such as disturbances, i.e. noise complaints, which could overlap with drug and alcohol abuse. Even still, those calls don't constitute a majority of the public's request to police. We then obtained the last 5 years of charges, both felonies and misdemeanors, brought by the Davis Police Department to understand what types of crimes are being committed in our city. The general categories on the top of the graph are, again, from left to right by severity, increasing severity on the right. A reminder, just so that everyone's aware, someone can be charged, obviously, with multiple crimes during a single arrest. So we also analyzed the data by arrest, but the trends were the same. So when we analyzed over 5,000 charges, surprisingly, we found almost 50% were for alcohol and drug-related offenses. 19% were found to be for property crimes, such as theft or burglary, while only 14.4% were for the most severe crimes, crimes against persons, which include assault and battery, sexual assault, kidnapping, and homicide. Comparing the relatively low incidence of alcohol and drug-related service calls from the public and the fact that the majority of charges brought by Davis PD are for substance abuse, it's clear there exists a disconnect between the public need and the police department response. These data give us an idea of what crimes are being committed and what activities are being criminalized in our city. In other words, possible challenges that we face with respect to public safety. We also wanted to gain insight into who in our city is actually being arrested to determine if there any racial inequities exist. This in particular is important when considering the current national conversation surrounding the Black Lives Matter movement. Using arrest data from that same time period, the last 5 years, we found that the majority of crime is committed by white people in our city, which is consistent with the proportion of white people in Davis. However, we found stark disparities between the percent Black and Hispanic population of Davis and the percent Black and Hispanic arrests in Davis. Normalizing arrests to the population in Davis, we find that the arrest rates per 1,000 people are higher for both Black and Hispanic individuals than for white and Asian individuals. Importantly, Black people in Davis are 5.5 times more likely to be arrested than white people in Davis. In addition, Hispanic people are 1.5 times more likely to be arrested than white people. As I wrap up, a quick reminder, arrest rates are not merely a function of crime rates. It's not a direct one-to-one connection. Importantly, racial biases at multiple levels of police and law enforcement interaction with the public must be considered as possible contributory factors when discussing arrest rates. Examples include racially motivated 911 calls, which have made headlines, especially in recent years, or over-policing of lower-income neighborhoods, which can disproportionately affect non-white individuals. So thank you so much. And with that, I will turn it over to Caitlin French.
Thanks, Morgan. So the data we've presented so far have highlighted areas of policing that might be better served by other departments, as well as stark racial disparities in who is being arrested. Zooming out to the bigger context, current calls to re-envision public safety are really a call for a public health approach to safety, not only recognizing the overlap between health and safety and their determinants, but also in the approach itself. While the current criminal justice system focuses on reacting to and punishing criminal acts, a public health approach centers on understanding and addressing root causes. Under this framework, our team took a look at existing research to identify the primary social determinants of public safety. In other words, what are those essential building blocks that lead to members of a community feeling and being safe and healthy? And we've summarized our research so far in this conceptual model on the left that highlights main social determinants. And you'll notice that many of these determinants reflect basic needs and economic security, including access to housing, food, sufficient income, education, and that many of these also overlap with health and overall well-being, highlighting that safety is a part of public health and should be addressed in a similar way. And an overarching determinant that runs through and intersects with all these areas is social equity, because inequity in any of these determinants implies that the safety of some are more at risk than others, and also presents threats to public safety as a whole. An easy example of this is to consider how wealth inequality in a community might lead to a greater likelihood of theft or burglary. We've also included anti-racism alongside social equity, because considering the deep historical roots and continuing pervasiveness of racism in our country, any vision for future social equity will require a continual proactiveness in dismantling problematic policies and behaviors, likely for generations to come. So in terms of immediate threats to public safety, we found they fall under two main categories. First, there's crime itself, being committed within communities of civilians against each other. And secondly, there's also institutionalized or legitimized forms of violence and neglect that threaten the well-being of a population. Under these two kinds of immediate threats, there's social determinants of each to consider, and many which are overlapping. So what kinds of breaks or failures in the system prevent us from attaining this vision of public safety? First, in contrast to our ideal of social equity, social and economic inequities on the basis of skin color, national origin, gender, and sexuality, for example, can manifest in reduced access to income, housing, healthcare, and quality education among affected populations, while at the same time exposing them more frequently to law enforcement and incarceration. Ultimately, these system breakdowns result in conditions that turn out to be determinants of crime. A few of these examples that we are going to focus on in the context of Davis are substance abuse disorders, lack of housing, and mental health issues. These systemic issues also allow for institutionalized harm, such as mass incarceration, to occur. Considering that the institutions charged with addressing public safety can also pose threats to it, we see a feedback loop in which worsening conditions can spark crackdown on crime that in turn can worsen conditions. Taking a closer look at how this feedback loop might play out, we found evidence that criminalization and incarceration as responses to mental illness and substance abuse is in many ways not only ineffective, but also potentially harmful. Looking at police encounters, a study found that fear of arrest among drug users may hinder them from seeking medical services. In addition, a substantial portion of people killed by police suffered from mental illness. This raises many questions about how mental illness can better be handled from the standpoint of preventing crime, as well as improving de-escalation skills among first responders. Looking at incarceration, we find that inmates with serious mental health problems and those with drug dependencies often have limited access to specialized treatment, in particular in jails. We see similar issues among houseless populations. For example, research has shown that when people are worried about police interactions, they report worse mental health outcomes and sleep habits. In addition, being forced to leave more public areas can increase risk of exposure-related health issues such as dehydration and cold-related illnesses, and risk of being assaulted. And again, contact with law enforcement rarely connected people with services that they are in need of. These studies provide support that high police contact and criminalization of homelessness is not an effective strategy, particularly in trying to help those who are most difficult to reach. And with that, I'll turn it over to Julia.
Hi, thank you, Caitlin. So keeping the social determinants model that we discussed, as well as the ways that the breakdowns in the system can lead to a less safe community, we're now going to look at data that points to some of these breakdowns and outcomes in Davis. And so a major social determinant that can affect public safety through multiple pathways is poverty and inequality. So looking at Davis, the overall poverty rate is almost 30%, while non-student poverty, so not considering students, is 10.32%. And that 10.32% is below average of California as well as Yolo County. However, when we look at median income among the whole population broken down by race, which you can see on the graph on the left, with each color representing a different race or ethnicity, and the wider bars representing Davis statistics, we see major disparities in terms of income, with white households having higher income than all other groups in Davis. And we particularly found, when diving further into the data, that Black women are the most negatively affected by this disparity. We see this racial disparity also reflected in food stamp data on the right. We see that there's a higher percentage of Black and Hispanic residents who are on food stamps than those of other races or ethnicities. And it's important to be aware of these disparities because we know that they can lead to negative outcomes in terms of public safety. So in that vein, we also examined some of the negative outcomes we expect to see with a system breakdown. Because in the arrest data we saw such a high percentage related to substance use, we went and looked at that data looking at specific drug charges. And surprisingly, we found that 91.75% of drug-related charges were for personal drug use. So that's things like possession or public intoxication, as opposed to sales or distribution or manufacturing of drugs. And remember that a third of charges brought by Davis Police Department are for drug-related offenses. So of total charges, personal drug use makes up 32% of total charges over the last 5 years. So this is an indication that we are criminalizing drug use, which we know from the literature is not helpful in aiding those with substance abuse disorders or for helping improve the safety of our community by breaking the substance abuse to prison cycle. And we can even see that criminalization of those with serious mental illness or those with substance use disorders is not effective by looking to our own Yolo County criminal justice population. We see that those with serious mental health issues have a 2 times longer jail stay than those without them, and are also highly likely to be arrested again. And for substance use disorders, we see that those who have finished their sentences still struggle with addiction. This is revealed by the recidivism risks outlined by Yolo County, where 2 of the top 3 risks involve access to or use of drugs, and also in that 2 out of 3 people on probation in Yolo County have substance abuse disorders. So again, we see that we're not effectively treating these issues. And just really quickly, because I know this commission is familiar with the YOLO homeless count, we do want to point out that we have a portion of our homeless population that is frequently homeless, which means, which is defined as homeless on at least 4 separate occasions within the last 3 years. So this is an indication that our current system is not reaching everyone who's in need. And finally, we want to show the existing interactions among the public health and safety challenges that we've been focusing on, because they all arise from similar breakdowns in the social determinants of a healthy society. So on the left is a graph showing the proportion of the surveyed members of the Davis homeless community who self-reported mental health or substance abuse issues. We can see that 30% or higher reported having substance use disorders, serious mental illness, or to be suffering from PTSD, and that 21% had a co-occurrence of mental health issues and substance use disorders. We also found that over 50% of those surveyed had been convicted of a crime. And finally, taking a step back among the general public and on a national level, the National Institute on Drug Abuse reports that over half of those with mental health issues will suffer from substance abuse disorders at some point in their lives and vice versa. And so we can see that all of these outcomes are interconnected and overlapping, and that they're symptoms of a system that's not functioning like it should. So now I will turn it over to Rowan to talk a bit about alternative practices.
Hi. My video won't go, but that's okay. We want to reiterate here the high overlap between social determinants and public safety. As was highlighted before, the current punitive approaches are not only inefficient, but often harmful to folks who are already vulnerable. So we did a survey of alternative models to consider for replacing the current approaches. As we surveyed alternative practices across the US that might be employed here in Davis, there were a few valuable points we kept in mind. 4 core values we held in view. Social equity. Considerations of alternative practices must include discussions on decreasing equity gaps. This includes increasing racial diversity in decision-making processes in government. Promotion of well-being. Actively consider mental health a public safety issue. Proactive versus reactive. Let's work towards a restorative and healing model rather than a punitive model. Currently, police department is a reactive system. Public safety issues that arise from inequity and lack of access to resources will never get resolved with police response or a punitive justice system. And 4th, shared responsibility. Spend funds proportionally to the needs. The police department cannot be expected to respond to everything. Let's expect appropriate funding to come from appropriate sources. In terms of examples that are relevant to our community, we were able to find great alternative models to gain knowledge from. As we saw earlier, most calls for service here in Davis are not for violent crimes. In fact, it's less than 2%. Programs such as Right Care program in Parkland Hospital, Dallas, Texas, responds to people experiencing behavioral health emergencies. Established in 2018, Right Care program is a partnership involving specially trained paramedics from the Dallas Fire Rescue, officers from the police department, and behavioral health social workers. Right Care team responds as a coordinated unit to safely and effectively manage patients. The Right program has been able to divert 31% of mental health crisis calls and connect patients with community resources. This program is an example responding to patients in hospitals and jails, which is why police officers are on the team. For our purposes, with violent crime in Davis accounting for less than 2% of service calls, police response may not be necessary. In another example that my teammate Aarthi will show later, Cahoots, armed officers are not involved in the response to mental health crisis, and this is a very successful model as well. Now we will turn it over to Aarthi Sekar.
Thank you, Rowan. So our team in our research came across several initiatives in terms of alternate policing, which include a handful particular to California, one of which being Assembly Bill 2054, also known as the Community Response Initiative to Strengthen Emergency Systems Act. AB 2054 seeks to address emergency issues such as mental health and substance abuse crises to be addressed in a safer, efficient, and more cost-effective manner by encouraging partnership with community organizations that often have deeper knowledge and understanding of the issues. The bill seeks $10 million in funds dedicated for the creation of a dozen or so pilot programs around California that would work to remove police from responses to crises involving mental illness and homelessness. And we, City of Davis, may consider positioning ourselves in being considered as being one of the pilot programs. Additionally, we would like to highlight that there are a number of cities in California that are moving to promote alternative practices. And this includes Alameda County, whose program CAT, or Community Assessment and Transport Team, seeks to implement efforts similar to the RIGHT program in Dallas. Oakland has allocated $1.35 million to a pilot program for similar efforts. And Mayor London Breed recently announced that San Francisco will implement a program that has trained unarmed professionals to respond to nonviolent crises, such as involving homelessness or mental health. And also remembering that the most common charge type in Davis is substance abuse, and that in Yolo County, clients with a serious mental illness remain in jail for twice as long, with our higher incidence of repeat arrests. It is essential that alternative practice aiming to respond to nonviolent crises are explored. The CAHOOTS program in Eugene, Oregon, which has been operating for over 30 years, responds to nonviolent crises by mobilizing a two-person team, including a medic and a mental health crisis worker. In 2018, CAHOOTS responded to 20% of all first responder calls within Eugene, and the response cost was at $800,000, while the Eugene Police Department's overall response cost for the same year was $58 million, saving the city of Eugene a substantial amount in public safety spending annually. So to summarize and reiterate some important points, we've seen that punitive approaches to nonviolent crimes are ineffective and unarmed first responders are essential. We need to relieve burden off of the police, and it is critical that we consider initiatives to address mental health, substance abuse, and houselessness in Davis. From our research, it seems that one of the most effective things that can be done is for the city to consider hiring a consultant to advise on restructuring current response methods. Yolo County Health and Human Services Agency is already working towards hiring a consultant to help with restructuring, and a City of Davis consultant could serve as a liaison. And lastly, and very importantly, we want to acknowledge the work that the Commission is doing, and also that Davis has a large number of academic researchers and professors who have the tools and skills to survey literature and resources to help with the work. And we want to let you know that we are here to do the work, and we want to support you in doing the work. So thank you for the opportunity to present tonight, and we welcome any questions.